What if one of the most overlooked drivers of patient outcomes, staff retention, and even your brand isn't clinical at all, but food? Not as a line item, not as a necessity, but as strategy. In this episode of The Architecture of Healing, I'm joined by Scott Reitano, the founder of Reitano Design Group, to unpack how healthcare food service is quietly evolving into a critical driver of experience, recovery, and long-term health. We explore why food is medicine is more than a trend, and how the design of food environments can actually influence behavior, and why leading health systems are rethinking everything, from where dining is located, to how meals are delivered, to how nutrition extends beyond patient discharge. Because this isn't just about better food, it's about a fundamental shift, from reactive care to proactive health, and the role the built environment plays in making that real. If you're a healthcare executive, designer, or strategist thinking about the future of care delivery, this is a perspective you can't afford to miss. Welcome to the Architecture of Healing. Today I am joined by Scott Reitano, the owner of Reitano Design Group, and really excited to chat with Scott today. We have a very interesting topic that we are going to dive into related to healthcare food service. Something that doesn't get a lot of attention, but very much important as it relates to patient care, care delivery, and overall patient and staff satisfaction. So welcome to the podcast, Scott.
Thanks for having me, Chase. Excited to be here, man. Very excited to be here.
Starting off, healthcare food service. How did you get there? How did you find this niche of, I want to design food service spaces?
It's not something you go to school for and immediately go, oh my gosh, this is what we're going to do. That's for sure. But I was a manufacturer's rep, believe it or not, for 17, 18 years before starting a design firm, which is not a leap that a lot of folks make per se, but been on my heart for a while. And the beginning of our company coincided with the birth of our daughter, and we weren't even supposed to have children. And I knew it was time to get out of a very safe boat, and always been very excited about the operation, whether it's healthcare or higher education or primary ed or what have you. More than just what are the pieces in there, but what does that look, act, and feel like? Chase, and I know we'll talk about it today. What's the impact of the food program in these venues? And is there a nutritional link here? And how do we entice people to eat healthier? And it's been a journey. We've been doing this 20 years, and I continue to learn. I'm blessed to work with an amazing group of professionals and some awesome, crazy projects, and you learn every time and you just keep rolling. And the professionals on the other side, the nutrition professionals, are unbelievable in how well they know their operations and what they're trying to accomplish.
That's really funny that you mentioned the birth of your firm with your daughter. I'm in a similar place. I just had my third child and just launched this podcast. Why not? What great time to launch something new when you're having a kid, right?
Yeah, you and your lovely wife are now outnumbered 3-2. And honey, I'm going to do this podcast as well as my day job. Good luck, everybody.
Yes, absolutely. Yeah. We're having fun with it. So
amen, man. Amen.
So you mentioned nutrition.
Yeah.
As we look at clinical food service in a healthcare environment, you really have a few different verticals, if you will. You've got your retail food service, you've got your patient care food service, and then you maybe have a catering food service line.
Yeah.
Can you break down the differences of maybe the different types of food service that you may have in a hospital?
Yeah. And interesting, and you nailed it. It isn't all, okay, this is the one operation we're doing out of this one central space. You're looking at different constituencies, quite frankly, and different operational goals for the facility as a whole. So certainly front and center is, what does patient meal service look like? Whether that is the room service model or, hey, we're throwing trays out all at the same time. These are lunch hours and this is what you're getting, obviously. But that's always what folks think about when they think about hospital food service is that, and not always with a smile on their face or a wow expectation. Chase, we're working on a huge hospital, largest hospital project in the United States right now, happens to be in Indianapolis. And there's going to be 864 beds in this facility. But by the way, there's going to be people working there as well. Overall, umpteen floors, I think it's 18 floors or something like that right now. And at different ends of the building, this is their work environment. So for them, this isn't a hospital food service or a nutrition scenario. This is workplace dining. What does that look, act, and feel like for them? And then all of those patients and all of those visitors, this is a retail experience for them. I say we don't have a lot of captive audiences left. Like you can hit your phone and get something delivered or what have you. We have convenience audiences that say, wait a minute, I like what we have here. And the food is quality, or it's what we're looking for. There's enough choices. You have an opportunity to serve your people right there as a revenue source even.
It's almost like a staff amenity to recruitment and retention. How do we engage staff in a different way, more meaningful way?
And make no mistake, as a health system, you have your brand involved in this. We can call it hospital food service. We talk a lot about nutrition. I always say we want to entice people to eat healthier. Like, you could go into and we learned this, the Shawnee Mission Medical Center in Kansas City. We did a project way back when, and we've said since then, if your child's in the hospital and man, you just want a burger and fries, that's your comfort food, the food police aren't coming. So that might be one of your menu options, but man, you walk into the serving space and Chase, you have to go by the coolest fresh food bar you've ever seen. And is that a chef chopping food over here? And make sure we understand what the food cues are and how do we entice people to eat healthier versus, no, you want a burger and fries, it's up front because it's easy or it's the lowest common denominator. How do we move people in a different direction by what we do with the built environment, quite frankly?
Going back to the patient service
Yep.
and the patient line and thinking about nutrition, how do food service teams and the planning around food service environments, how do you take into consideration patient outcomes, length of stay, recovery, readmission with food service and nutrition, and really equipping those patients with the tools that they need to recover well?
Wow. First of all, the fact that we're having this conversation is, in relative terms, relatively new. It was almost like food wasn't an amenity per se, it was a necessity. And, oh yeah, we got to put space in the building because they got to run trays up. And what we're learning even in the medical world, and some of this is our own health journeys, that by the time you get to the doctor, how many things could have you done nutritionally to support better health, to not even have to be in that scenario, so to speak? And now food as medicine is a term you're hearing more and more. And so now the conversation is truly shifting to, wait a minute, and this might be, for some folks, a journey they'd never gone on. Oh, wait a minute, me eating my fruits and vegetables, I know low bar, but me eating my fruits and vegetables does impact my health. Or when we talk about your recovery from X surgery or X medical condition, hey, wait a minute, let's think about what's your salt intake to what's your sugar, in my world, what's your sugar intake? I did think ice cream was its own food group for many a year, but that's part of what people are paying attention to now. And it's a much more collaborative environment. What we're asking of our nutritional professionals now is, and allowing, quite frankly, is a voice in that patient care realm where it used to just be, make sure you feed some people and then we're going to get them out of here.
With the nutritional component and catering those menu options and dietary options to individual patients, are you seeing more of that where you have structured menus for particular patients or patient types with certain types of acuity levels?
Yep. Yeah, it's interesting. The menu should drive production and drive operation. And there's always been a, hey, they're sodium free, or, oh, that meant you got 2 selections over here, right? Or reduced here. I think what we're finding, there's more variety even in a specialized menu. And so it's not like you're getting penalized as much as maybe you once were. And I think what's really interesting is the patient themselves is much more informed than maybe we have been in the past. And so you're asking for different selections, or you're asking for more nutritional values on a menu to understand. I know the big thing these days is protein. And it should be the big thing, by the way, but there's some real grabs from a marketing standpoint on some people. That's not really that much protein. But as people are understanding what the nutritional values are, or from a professional medical standpoint, hey, we need you to have X amount of calories, and sometimes that's more, not less, or this is what we're looking for a protein level. This is the reduction in sodium we're looking at, those kind of things. You can nuance that with a lot more of the menu now than maybe we ever could before. So supplying that information and having that available has been part of this journey as nutrition becomes a real part, or food as medicine has become a real part of the overall program within our healthcare system.
I think that too extends to emotional well-being, right? If you're in the facility, you're stuck there for a number of days.
Yep.
You don't have a lot that you can control in your environment, but you can control, to some extent,
Yep.
what you eat. How does food act in a healthy way as an emotional support element in a care environment.
They say moderation is key in all things. And so to put a menu in front of somebody that doesn't say bland and then more bland, and we've got some bland over here, like, that they have some control over it. And some of that obviously is what's on the menu. And and by the way, apparently the older you get, the more like what I'm eating at lunch. I'm thinking about tomorrow's lunch already. Or meals are a bigger part of people's lives. And as you can imagine, being in the hospital, to your point, I can only control so much. So the other thing that comes with that is, Chase, not everybody wants to eat breakfast, lunch, and dinner, and it's in these hours, et cetera, et cetera. And being the parent of my own focus group, my daughter and all her friends of Gen Z, and now you're in for it, my brother, but you're going to see more and more of Gen Alpha. These guys aren't breakfast, lunch, and dinner folks. Like, they're snacking their way through the day, and I want this here and there. So that food amenity, if you will, or that nutritional supplement doesn't just say, we're going to come see you 3 times a day and this is what you get. There may be other options, what hours you have. You can work around your tests, or maybe every so often it's just a protein shake and it's not a full meal. But having that food availability, for lack of a better term, I think is really important.
Yeah. That's really interesting with how people consume and their lifestyle choices, with how they choose to have relationships with food, and being able to, in this care environment, cater to different types of people and choices in terms of how they choose to eat.
And it's interesting because I think we're seeing a spread of 2 things. Number one, there's a pre-patient stage of this thing, and there's a post, say, at the hospital scenario too, that all of a sudden, I don't want you walking out the door and going back to your bag of chips for lunch and ice cream for dinner model. So bringing in a dietitian, bringing in nutritional education as part of what you're doing here. And then the measuring of that, from not only from a health standpoint, like, oh yeah, I do feel different, like on a personal level, but on a cost of healthcare level. Let's put it this way. The last resort is you ended up in a hospital, or that you're sick, or that something happened. So when you're walking out, if you've got a nutritional plan in front of you and a way to execute that nutritional plan, that's got to be part of it too. And then as folks that design kitchens and those spaces, we got to think through, how do we set people up for success in that realm? So all of a sudden, are we not just making sure that the line is filled for lunch and that all the tray carts are ready to go? Are we talking about, what do meals for home look like as you walk out the door? Hey, we got you set up for a week. Here's what that looks like. Here's what the nutritional value is, so that people can get a rhythm of eating healthy. I mean, it's like anything else. Once you get that habit going, you move in the right direction and you're like, wait a minute, I do feel better. But that's not just while you were with us in the hospital. So the component of where nutrition and where food plays in a medical journey, for lack of a better term, I think works too.
That shifts into that patient education, and here's your recovery instructions, and here's your discharge instructions, go home. And it almost becomes like this bridge from in a healthcare setting, in a hospital, to a prescribed diet and an eating plan, right? So it's like the pharmacy of food service. Like, I've got family members who will happily take a pill, but they will not eat right to save their lives. And so here's your 4 broccoli pills today, and here's your 3 3 salad pills today.
And there is a place for supplements or what have you. I get that, but getting our nutrition from actual real food kind of makes sense.
Absolutely,
I've seen, and I love this, almost a rating system sometimes, like even as a visitor in a hospital or a staff member in a hospital, when you go into the serving space, almost a red, yellow, green kind of scenario. You can have a little bit of this. You might want to limit your portions here. Wait a minute, you can do much more of that in moderation. And greens, come back again. You can have more of these. But just that kind of subtle teaching as we go. People make their own choices every single day, and they should. We're adults, for goodness sake. But the guidance systems in place around us. And to me, if you're a health system, doesn't that speak to health system or health environment? Point people in.
I love that. I love the red, yellow, green idea. I was thinking of this idea of how in, say, retail food, there's this conscious effort to sell the food by how it's described on the menu. Crispy, pan-fried, bacon, wrapped, Angus burger,
Yes.
you know?
You
And
just said
then you
heart
go
attack. That's
to,
what you
yeah, yeah, exactly. But then you go to maybe a healthcare setting where it's hamburger. Man, that doesn't sound good. It just sounds like hamburger. And I don't know what's on it.
Yep.
And so it's almost a patient experience thing of let's really, I know that they are going to order off this menu and it's going to be one of these things that we don't really care what it says, but it's a patient experience tool to engage the patients and have them
Yeah.
build on their journey through care.
Chase, we all eat with our eyes.
Yeah.
Like those, in a school environment, how you present things. I always laugh. You want to increase the consumption of apples or oranges or fruits. You slice the apples and you sectionize the oranges. And I used to think that was just for little kids, but my wife just laughs at me. She goes, "You want that cut, don't you?" Yes, ma'am. It works. And by the way, stick some peanut butter to that, put it on a cold shelf, and all of a sudden people are going, "Oh, that's appealing." That's one thing, but presentation still matters. Communication, only so much of it's through the written or spoken word. Like having pictures available matters too.
Have you seen other tools or ways, be it in the retail food service environment in a hospital or in a patient care line, where the patient experience is elevated and different ways that you can do that through the food service?
Availability. I think we've all seen mainly on college campuses, like the robot that does food delivery.
Yeah.
My daughter's seen that way too often, to be honest with you, as she's a junior at Miami University. But people are used to a certain level of, I can get this food. And hand in hand with that is the days of the old vending machine where is that egg salad sandwich in that little triangle? Like, how long has that puppy been in there? So vending is not a bad word anymore when you have the ability to put fresh food in there and payment systems. There's a term in our end of the industry called distributed dining. I mentioned a large hospital going in downtown Indianapolis. Bob from the 9th floor or the 10th floor at one end of the building to try to get to just one place that we're serving food at the other end. And he's on a 30-minute lunch hour, so to speak. That's not gonna happen very often. So intentional about where we put food. So food availability, intentionality about what's the quality level. And I just mean food quality to start with, Chase. And then what's the nutritional value of what we're offering? Those have to play hand in hand. Available, quality that you want it, and nutritional. You don't have to sneak in the nutritional, but it should still look good. Nutritional shouldn't be crap. What would I have to give up to get to that,
Well, and that's so true, the availability. Speaking of my own recent experience when we were there having our son, I was not able to order food from the patient line, only my wife. So I would be going downstairs to pick something up from the retail kitchen.
Yep.
And without fail, every time I left was when the doctor came in. And I missed everything every time. And so the further you have to go, you're missing the time and you're not there for the whole care process. And so there is some thought to that from a patient experience as well in terms of where things are located.
And things, whether the cool restaurants that have the robot bring your drinks to the table or something like that, or the college campus I mentioned that has Zippy going across. In hospitals, even today, like services going up via robots in a lot of places right now too. I do think it's hilarious. Some of these robots are the most kind, polite things you've ever seen. Like on a college campus where kids just go running across when there's enough of them, whether it's a green light, red light, whatever they go, you'll watch those little guys just sitting there. Oh, can I go? No, I can't go. Oh, no, can I go? In a hospital setting, they all come to like a 4-way stop and nobody wants to go. Like there's a traffic jam. But when it's done right and they've got it rocking and rolling, you're sitting with your wife. You're exactly where you're supposed to be in that moment. Yes, you're still hungry, but you're still where you need to be. We should be able to get the food to you. Don't get me wrong. There's labor considerations and everything else. I think there's an investment that between human labor and figuring out what level of technology works for you in any given institution or organization is all going to play into this.
More on the whole patient experience. I remember, and maybe it's further back than I give it credit for, but let's paint this picture, right? So in rural communities, the hospital dining room was a community center. Everybody would go there. They would go there for lunch, breakfast. They would meet their friend there for coffee. It was a hub. And over the last 15, 20 years, we've gone away from that. Is that somewhere that healthcare is going back to?
So hospital and hospitality are supposed to go, I mean, that they're born out of the same word, for goodness sake. We're seeing more of a trend towards, geez, there's many a hospital where, hey, where's the cafeteria? Okay, you go down to the basement, go back here, go over there, almost like we stuck it on the back of the building because we had to. More and more and more, what we're seeing is that dining experience is coming forward, almost lobby level kind of amenity that says, this is what we're about. I mean, think about it. When was the last time you were at a party where the fun of the party didn't end up everybody in the kitchen? You know, I mean, food's always a part of things like that. And so if you want to build community, you don't stick the hospitality aspect of that somewhere down deep, deep, deep in the dregs of the basement area. You move more towards front and center. And again, stay on brand. You're a health organization. Healthy food, yes. Good food, yes. The same thing, yes. But it also, and we see this more in rural communities sometimes than we do in urban settings. But it might be one of the few restaurants, quote unquote, right in town. And that's okay. You're part of the community. You're opening the doors. That tends to move more towards senior citizens, us younger folks most of the time. But we all need community. So how many ways and how many different vehicles can we use to make that happen? And can this be part of that conversation?
I might even argue that this is something that maybe a rural hospital and an academic medical center in an urban setting may have in common, in that you're part of the city grid. You can place that food service right there at street level where any Joe or Steve walking by can just stop in and grab a bite, but it's part of the hospital. And
we definitely have that going on. And I love this one. IU Health is in Bloomington, built a brand new hospital right next to an academic building for Indiana University. We said, well, you're going to connect those because the food. Well, we're not sure the students will come over. Here we are 5 years into it. You're darn right the students are coming over. Of course they are. It's good food.
So I'm going to pull on this thread a little bit more of where the dining area is located in the back of the facility versus the front. Historically, it's placed towards the rear, lower level, to be near the loading dock, to be where the food's coming into the building, to create that efficient workflow. But as you noted, it's being pushed forward. It's being elevated to that hospitality type experience. How do you navigate prioritizing that with other, maybe in some of those larger conversations, clinical workflows that may want to break that up and say, we need to push this here because we have to prioritize the location of pharmacy or lab or sterile processing and all these things that may need more attention?
So we never want to forget that if you're not a restaurant, we are not putting a food service establishment in places as the primary function, whether it's on a college campus or in a hospital or in a workplace manufacturing facility, if you will, or a school. Like, they didn't build the building so that we could have a really, really cool kitchen, serving area, dining space. But the earlier that it's part of the conversation, as it's not just an extra, that it's part of it, the better. The technologies in our world of food service, and yes, we still cook on fire. I'm just going to admit that up front. Like, we haven't gone so far down the road. But the technology is involved in the ability to deliver fresh food in different atmospheres, in different places, and quality fresh food has gotten better and better. I would argue as an advocate for what we would call like a ghost kitchen or a production kitchen that serves several different venues. So you can imagine out of this production kitchen, we're directly sending patient meals up to the floors, no problem. Yes, we're still close to the back door, if you will. And then maybe the setting for where we're going to serve staff and visitors and things might not be connected to that production kitchen, but we can have finishing equipment or ventless equipment even in those venues. So you're still getting fresh food, but maybe it was prepared in our kitchen. Maybe we used a blast chiller to get it through what we call the danger zone, or we cooked it about 80%, hit it through the blast chiller, and we actually finished the product right in front of the client in a dining space, in a spot in your hospital that you wanted to yell, hospitality, hospitality, hospitality. And out of that same production kitchen, that's where maybe those little nooks for distributed dining, if you will, are on the different floors and supporting those vehicles as well. a small cafe on 7 or, whatever that looks like.
With what you described, I think that's a great example of what I'm about to ask. But are there other ways that healthcare organizations are rethinking food service models, maybe in labor shortage scenarios or with maintaining the quality of the food and the prep time it takes for certain dishes to be prepared?
Oh, yeah. I mentioned a blast chiller in passing, and it's just one piece of equipment. But how do you maximize your labor when you have it for X amount of hours, and using different ways to prepare food and then bring it down to the appropriate temperature? There's models to do that. And then the transportation of food without losing food quality, or maybe it's an overnight task that we've got food in the proper places. We produced it at X amount of time. Now it's ready to go in these different venues. What I don't want to get lost in the conversation is, yes, nutritional value of the food is absolutely top of mind. Availability of the food is also very, very important in the quality of food. And we've mentioned that. I also want to say that the spaces that people are consuming the food is really important. So we can talk about that really cool dining area and it's hospitality and it's at the front door. But let's say you have a family member suffering through a really difficult moment, whether it's a surgery or it's a diagnosis or whatever's going on. Are there quieter spots that I can get an amenity and just stay where I am? Or can you bring it to me? Health isn't just physical health, but mental health. And more today than ever before, regardless of venue, we're taking a look at, some people don't want the crowds, and they might think a crowd is eating in a dining space in front of all these people. So are there smaller areas that we can still have that food amenity delivered to or ready for them, or picking up a food like mobile order pickup, so to speak, can be anywhere easily. Oh, you swiped your phone and here's your food kind of scenario. So those types of things are available. I think we always want to pay attention to labor as well. And there's some wins with whether it's the Amazon Go type of technology where you roll in and you roll out and you're kind of looking. Trust me, that's not the honor system. Like there's like 60 cameras. I always think I'm about to get knocked down by someone or hit with a taser or something. I paid. I swear I paid. There those types of things available, but there's a lot of different ways to accomplish that. But bringing food to where people are matters as much as anything else.
I feel like so many of these questions are tied together, because where I want to go next is, what are we seeing coming up? Like in the next 5 to 10 years, are there new technologies, new tools, new ideas in the food service space that may change the way we think about food service in a hospital?
There are. I mean, even different refrigerated cabinets. I know this sounds silly, but it knows what you took off the shelf. And I still think they're going to tase you or something. They never do, but it'll beep at you. No, put that back. Or other times it can be rated by someone that's running the cafe. So you've got off hours, part of the cafe is still open. And during other times, you just grab it and pay for it with everything else you just got. So there's a lot of that happening around mobile order pickup. I'll go back to Gen Z and Gen Alpha. They've never seen a menu that they thought meant you had to order off that menu. So I want this, but by the way, I want it without these 3 ingredients. I once watched a young man order the omelet of the day. And by the time he was done, I looked at him and said, dude, that's not even the same omelet. Like you take these 3 things out, put those on. Well, now you can do that off your phone. It's called line busting. And there's a technology that allows you just order it off the phone, so you're not standing in the servery waiting. There's a lot of kiosks, and people do the kiosk ordering right now. Chris Ware, our design principal, and myself were hosting some client friends. And Chase, we were getting lunch. And, oh, how cool, you order off the kiosk. And then everybody just blindly looks at their phone and stands in the middle of the space between the 4 concepts, waiting for their food to be ready. If you could have ordered off your phone on the way down and just grabbed it on your way through, there's no healthy human interaction there. Versus if you picture a Chipotle style where you walk down and they're putting the ingredients together for you, that makes maybe more sense from a human interaction standpoint. When I say technology, we don't want technology to replace human interaction. And so while there is technology available, I think it's incumbent upon us as designers, quite frankly, it's incumbent upon us to understand what is the community that we're playing into and what are we signing them up for based on the use of that technology. And so folks having honest conversations about what do you value in this particular setting. At 3 a.m, I value technology and not talking to anybody while I'm staying awake while my wife's having a baby kind of scenario, right? I get that. But at noon, maybe I want you to interact with some other folks or your coworkers. How do we set that vibe in place as well? Or at least ask, what are your values as a healthcare system or as a hospital or even, I know we're not necessarily talking senior living, but there's been some real advances in those places
Absolutely.
as well.
I may take your statement a bit further. We don't want technology to replace human interaction, but I would argue that
Yeah,
we want it to enhance human interaction. Like
every time.
we are using this
Yep.
as a tool to improve what we're already doing. And so
Yes.
thinking about it through that lens, even beyond food service and how technology is really moving us forward to be the best version of ourselves and not a different version.
And in our world, if we can help free up someone on the backside of the counter to actually say, hey, how's your day going? Or they say sometimes that's the only friendly face that they're going to see that doesn't want something from them. You know what I mean? We're not poking and prodding you to get the right blood test or what have you. We're just serving you a meal and saying hello, and I hope you're doing okay today. If the technology behind that, I knew what you wanted when you walked up, is part of it, that's awesome. But you don't want it to replace the human interaction every time around.
What can organizations do today that don't lock them into old and outdated models?
That's one of the number one things we talk about on a very, very regular basis is how do we build in flexibility? Because Chase, we're sitting here today having a nice conversation about what it looks, acts, and feels like today. And 5 years from now, it won't look, act, and feel like that. So we're watching some of the, I call it blocking and tackling of what are the ovens that you're putting in? How flexible are they? Your refrigeration equipment, are we thinking down the road of what that might look, act, and feel like? Things that don't change are nobody wants a dance floor in their kitchen. And so we're still looking at those kind of, wait, that's how you figured that was going to work? People work in these spaces, and we want to be as efficient as possible, as I like to say, behind the wall. Like that's a production facility. On the front side of that is a hospitality setting. And so we always try to, when I say build in flexibility, in the back of the house, it may look like what types of ovens we choose, that they can go in multiple modes. It also may be a conversation between our team and the engineering team to say, wait a minute, what are we doing utility wise? Because down the road, we may need to add this based on that. How easy can we make that for people to be able to think that through of things we haven't even thought about at this point in the game? And then on the front of the house, that might look like, I know we're pretty exciting in food service. It might look like quick switch wells, which can go hot or cold, or maybe they're not wells at all. We have different surfaces that can do those same kind of things. It might be set up for a breakfast buffet in the morning, and that's cold because we're doing some Greek yogurt in this one or some fruit in that one. And at lunch, it might be a hot, like a grilled chicken offering coming out of that same venue. Those are the kind of things we want to help people think through. And then in terms of food availability, even, we can put those heated surfaces or cold surfaces, quite frankly, build them in the counters in the back of a boardroom. We're bringing in the whole board today. Or down the road, it could end up in somebody's room if you wanted. Oh, your family's here. We're just going to place this on this nice credenza that now is heated to keep your food warm.
I think that's really interesting because for organizations that have a catering service for staff meetings or board meetings or staff events, you're saving so much by not having to bring the chafing dishes up, the hotel pans up, and lay that line out. You're able to set that up in place and eliminate a lot of extra stuff that you don't need to store and set up and break down and all that.
So it's never going away. If we're honestly looking at the operational side of things, is everybody has labor challenges. And so the equipment that we're looking at or what we're doing from a physical setup has to think through, quote unquote, the FTE part of this for sure. And the more flexible the equipment, the more versatile it is, the more things it can do without you having to touch it and move it from here to here, the better off we are.
So putting yourself in a CFO role and as someone who's making strategic decisions, how should that CFO think about food service and evaluate that as a cost center, a revenue opportunity, an experience driver? Is there a particular thing that CFO may want to think about and how they might shape their perspective on food service?
We're watching different health systems that we work with wrestle with this right now. And literally, to your point, I think you as an end user, as a customer, as a client, have to make the decision. Is this just a cost-driven necessity? I always use the reference in schools. The principal would say, oh, transportation and lunch. They treat it as a transaction. Those are the two things that interrupt their schedule, and et cetera, et cetera. If as an administration in a hospital that you treat food as a cost center, I guess we got to do it, but let's do the minimum that we have for our staff or what have you, then it's going to look one way. And you're going to reduce what you're offering. You're going to have not just less physical offerings, but it's going to be less a part of the overall program of how you're presenting your healthcare system or your hospital to the public, to the patients that are there, and to your own team. A significant amount of other folks that go, wait a minute. This is an amenity. And when I say it's an amenity, Chase, part of that amenity says, how do we retain good staff? How do we make sure that we are an experience that, and being in a hospital is never fun, obviously, but the folks aren't going to just remember that, oh, I did this many procedures, that wait a minute, this was a welcoming place, because they're competing with one another now more than ever. And so it's a viewpoint of, do you think that even as a community resource, are you really honestly pushing forward health, or are you pushing forward making sure that our bottom line maximizes how many dollars we make? And so are you profit driven? Are you purpose driven? And I think any organization, I mean, your organization, my organization, we're asking those same questions. It's at a much bigger scale, obviously, when you're in the healthcare game, but this is your brand, and I know I've said that before, but if food can be a part of the health conversation on a deeper level than we made sure they got fed while they were here, I think you win. If nutrition education is part of how you invite people into your community resource known as the hospital. Hey, we're having 3 different seminars on this, and this next week. You don't have to be a patient to come in. Please just come in. Or I loved your example of, where do you place it? Is it right at street level so anybody can come in and have a healthy meal? Not a healthy only meal, but a meal you'd want to come in off the street for, that, by the way, has nutritional value to it, that, by the way, carries our brand with it. But there's definitely folks that are looking at it just from a strict bottom line standpoint. How can I squeeze every nickel out of it? And there are folks that, don't get me wrong, no one goes, just open the bank and let's lose as much money as possible. But the funny thing is, I think the more that you put into it and the more that you make it part of your health and wellness program, that you've got fitness, you've got nutrition, if that's part of not just your messaging, but what you're doing, all of a sudden you're adding more value and more people are coming to be a part of your organization versus your competition.
It really isn't a straight line ROI. It's so complex, as if you invest in this thing, it's going to give you exponential impact in so many different other areas that you don't even have a pulse on, so to speak.
Yep.
But also, if you do take that approach of, we're going to keep this minimalistic and do what we have to do, there could be quite a few unintended consequences that come with that you're not seeing, including staff turnover or decreased patient satisfaction or even less effective outcomes with patients. So there are things that are really hard to connect. And I think that kind of puts the onus on the designers and us, as saying, like, how do we pencil this out? How do we show this as something that is of value and should be really invested in?
So it's one thing to see where this lines up on a Press Ganey scenario. Okay, we're at the right level there. It's another thing to think of it, and everybody's thinking of marketing and brand extension. So what if part of your brand was, yep, we're sending meals home with you, or we're a brand that shows up. You might stop in to that first level hospitality space within our hospital just to pick up some meals to go or ready to go meals. And they've got our brand logo on the top of them. Or you might even just stop in to grab a nutritional guide that we put out once a month and that you take with you, of highlighting what some of the things you should be thinking about. How do you create an atmosphere, if you will, where people know that part of your health journey has to be nutrition? It has to be food oriented. And then how do you measure, and why don't you measure more often, what were the better outcomes? In other words, how many people that followed our nutrition plan did not come back for complications to a surgery that they had in our hospital? Those are the kind of things that I think it's a different way of thinking maybe for some folks, but man, fuel in the tank matters. You know what I mean? And the right things in are going to extend people's lives. And even more than that, I think this is a quality of life issue. And that's really what this comes around to, is we might not always have a role in how long our life is, depending on what's going on, but in the quality of life, yeah, we get it. And sleep, exercise, and nutrition are the big thing. No matter how you say it or what you do, sleep, exercise, and nutrition are the big three.
Good.
And as a health system, you have an opportunity to speak into that.
Yeah. Yeah. Taking a step back, pulling out to the 500,000 foot view, and even beyond food service, if you were to look at healthcare as a whole and say, hey, I can fix one thing, I have unlimited resources, what is that thing that you are going to just say, I'm going to get my hands dirty and make that work?
Wow. If I was going to pull back even from food service and say, what could we do better? What could we do differently? I'll go this route because I'm on this journey a little bit myself. First of all, as a consumer of health services, it feels like you have to be your own advocate and you have to be your own quarterback of, who do I go see next? What test do I need next? What should I be doing? So if there was something that I'd love to see some real growth in, is that client advocacy piece of it, or primary care doctors that feel like maybe they're a little overwhelmed right now, quite frankly, and our medical system is. So there's some infrastructure piece of that. I'd love to see more on the pro advocacy side of it than a reactionary side of it, and setting people up for success. Yes, nutrition is definitely part of that, but so is thinking through what are the next set of tests you need to take to check and make sure we're catching this early before you have to, kind of scenario. And even, gosh, Chase, if we were going 500,000 feet, if you will, how is it that we have a healthcare system where insurance companies aren't paying for some proper tests to make sure that you're healthy? They're paying once you're not healthy. Wouldn't we be in a better place if some of those preventative type steps were part of the coverage plans for folks versus, oh yeah, you had this surgery, we're covering most of that, but you didn't cover 27 things that we could have caught it earlier if we encourage people to stay on a schedule and take, whether it's colonoscopy or, you know, whatever it might be.
Man, yeah, that is such a complex topic, and I couldn't agree more. There's so many things that really need to be evaluated in terms of care delivery and reimbursement and all of those things. Absolutely. Let's go. Let's jump into our lightning round. Let's bring it to a close here.
All
so
right.
What is one of your
Let's do
favorite healing spaces?
One of my favorite healing spaces is a church, man. I know that's off topic, but when you quiet your soul and you're just listening and learning and some worship, but that for me is a healing space.
Awesome.
Not a physical healing space necessarily, but definitely a healing space.
It's a whole body, physical, mental, emotional, spiritual, all of it, for sure.
Yep.
What inspires you outside of work?
My wife, believe it or not, Lori is, let's put it this way. Before I got married, I was talking to my grandmother, and my grandmother said, honey, how's Lori? And I said, Nana, I think I'm going to keep her. And my grandmother said, honey, the question's never been whether you were going to keep her, it's whether she was going to keep you. And I said, you know, you're my grandmother, right? She said, yes, I do. My wife's heart to serve others just unconditionally, day in and day out, with whatever circumstance that is, and to push through hard things, not by avoiding, but by walking straight through them. She inspires me to just try to keep up with that level of love and care for our family and those that mean the world to us.
Yeah, that's incredible. What is a book that has changed the way you think?
On a personal level, for me anyway, you got to start with the Bible. I mean, I'm still highlighting it, you know, I'm 10 years later. So definitely that's still my rock. On a professional level, and I'm famous in my family for reading about 2/3 or half of a book. I mean, my daughter makes fun of me well, she makes fun of me anyway, but she makes fun of, oh, Dad, you read about 2/3 of that one? Yes, I got the point. But the one that umpteen years later still sticks with me and I come back to, and my team's diving into it right now, even, is Good to Great by Jim Collins.
Yeah. That
book, anything from level 5 leadership and what that looks, acts, and feels like, to what's your hedgehog concept. I mean, there's some real lessons learned, obviously on a personal level, of course, too, but how do you lead an organization and how do you grow an organization? And what's the difference? Are you settling for good, or do you want to be a great organization?
Yeah, that's good. That's so good. It really challenges you to get the best out of yourself. And lastly, finish the sentence. The future of healthcare is blank.
The future of healthcare is unknown, quite frankly. Right now, we're, in my mind's eye, we're at a tipping point one way or another. We've chosen today to talk about what can be. Yes, we're going to include nutrition in part of this. And yes, there's a proactivity to this. The other side of that is a lot of people that are overwhelmed, overworked, under-resourced as well. And what are we doing to buffer that system and to move all in the proper direction? So I'll say unknown. I'm an optimist, man. So I'm betting the farm on all the good stuff. That's who I am. And that's what I believe about our country and about the world we live in, because humans are good people, as a whole. So I'll bet that way. But I got to tell you, we're at a point right now where we should be paying attention. And I think the proactive viewpoint of health, instead of waiting for the reactionary viewpoint of health and healthcare, is going to be the deciding factor for us.
That's big. Thank you, Scott, for joining us today. This has been a fascinating conversation just around food service, healthcare, and nutrition, and everything that comes along with those topics. There's so much more that we didn't even get to. I'm just looking here at my notes, and there's page after page of things that we didn't get to. This has just been the tip of the iceberg of what's to come in the future of healthcare food service. Thank you for being here. This has been really fun.
Chase, thanks and again, I'm a fan of your podcast in general across the breadth of it, but to have this kind of a forum, to have these kind of conversations, to listen and learn from one another is gold, man. So thank you very, very much.
Food service touches far more than a tray line or a cafeteria. It sits at the intersection of clinical outcomes, workforce strategy, and long-term population health. And what Scott highlights is a shift many systems are still catching up to: the move from reactive care to proactive health. Because when nutrition is embedded into the care journey, not just during a stay, but before and after, it starts to influence readmissions, recovery trajectories, and even how patients engage with their own health long-term. At the same time, these environments are shaping daily experience. Whether a clinician has access to meaningful, convenient nourishment during a 12-hour shift, or whether a family member finds a moment of comfort in an otherwise stressful setting. Those moments compound, and they matter. It shapes recovery, influences behaviors, and impacts how patients, staff, and communities experience your organization. When done well, it doesn't just support care, it extends it. So the question is, are you treating food service as a cost or a catalyst? If this conversation challenged your perspective, share it with a colleague who's shaping healthcare strategy, and make sure you're subscribed to the Architecture of Healing for more insights at the intersection of design and care delivery. Thanks for joining us.